Do you feel bloated after meals? Constantly burping or have a tight feeling in your chest? You might brush it off as simple indigestion, but is it really just that? Many patients who visit the hospital for indigestion are shocked by their diagnosis. It's not just indigestion, but an entirely different condition. If you're over 40, listen closely because the condition we're talking about today becomes much more common as you age. Let me ask you, when you have digestive issues, which department do you visit? Most people go to internal medicine or gastroenterology, right? But for an accurate diagnosis, you need a hospital equipped for endoscopy and esophageal tests. The real culprit behind indigestion? Gastroesophageal reflux disease, or GERD. You might think, oh, isn't that just acid reflux? That's a dangerous oversimplification. Recent studies show that many GERD patients don't experience classic heartburn, but instead have symptoms like indigestion. That's why it's sometimes called silent GERD. Here's the scary part: untreated GERD isn't just uncomfortable. It can damage the esophageal lining, leading to Barrett's esophagus, a precancerous condition that increases the risk of esophageal cancer by over 8 times, according to research. So how can you tell if it's GERD? The first clue is symptoms appearing 30 minutes to an hour after eating, especially when lying down. Second, you might feel a lump in your throat or have frequent coughing. Many mistake this for a cold, but it could be acid traveling up the esophagus. Third, and this is critical, if you wake up at night with a burning sensation in your chest, get checked immediately. But here's the tricky part: GERD can be missed even with an endoscopy. About 60% of patients have non-erosive GERD, where symptoms are severe, but the esophagus looks normal on an exam. So how do you confirm it? The most accurate method is a 24-hour esophageal pH test, but it's uncomfortable and costly. A simpler approach doctors use is the PPI, test taking proton pump inhibitors or acid-suppressing medication for 2 weeks. If symptoms improve by 50% or more, it's likely GERD. But never take these drugs without consulting a doctor. Self-medicating risks missing other conditions and can cause side effects. Here's another way to check at home. Keep a symptom journal for a week. Note when symptoms occur, what you ate, and your posture. If symptoms worsen after coffee, chocolate, greasy foods, or acidic fruits, GERD is a strong possibility. So how do you treat GERD? Many think medication alone is enough, but that's only half the solution. Lifestyle changes are even more important. Here are the 5 most effective ones. First, don't lie down for at least 3 hours after eating, and avoid food 3 hours before bed. This uses gravity to keep acid from rising. Second, sleep with your upper body elevated at a 15-degree angle. Just propping up pillows can strain your neck and worsen symptoms. Use a wedge pillow or raise the head of your bed to reduce nighttime reflux by over 50%. Third, eat smaller, more frequent meals. Large meals increase stomach pressure, triggering reflux. Fourth, quit smoking and limit alcohol. Smoking weakens the lower esophageal sphincter, making reflux worse. Fifth, manage your weight. Abdominal fat puts pressure on the stomach, causing reflux. Here's another critical fact: GERD isn't just a stomach issue. Recent studies link it to sleep apnea, asthma, and even dental problems. If you wake up coughing at night, it could be acid reaching your airways, a condition called laryngopharyngeal reflux, which can lead to serious complications. Even more surprising, GERD symptoms can mimic a heart attack. Many patients visit the ER with chest pain, only to be diagnosed with GERD. Never self-diagnose chest pain, always see a doctor. Here's the most important point. GERD is a chronic condition that's hard to fully cure. But don't worry, with proper management, you can control it and live a normal life. The key is early detection and consistent care. If you're watching this and thinking, I might have those symptoms, don't delay, consult a specialist. Especially if you're over 50, have a family history, or symptoms have lasted over 3 months, get a thorough checkup. Health is hard to regain once lost, but with awareness and action, you can prevent serious issues. I hope this video helps you take a step toward a healthier life. If you have questions, leave them in the comments. We'll keep bringing you valuable health insights in the next video. Stay healthy.